Okay, so welcome everybody. We are very excited to host this quiz. We've been wanting to do it for some time now because the initial idea was to celebrate 1 year of this group. And it started off with a very, very small number of people. And we are very proud that we have now grown into a very big family with a lot of people from overseas also giving their opinion. So there is that. And Rare Disease Month just came to an end. And we have all in our respective centers been taking initiatives, doing our bit to help patients with rare disease. So this time we thought we should do something different rather than just a lecture teaching each other or discuss cases. So this is all for fun. We have things lined up for the audience and we're very excited. So I'll get right into it. So, you already know Dr. Shailja Tibrewal at Dr. Shroff's Charity Eye Hospital. She's a pediatric ophthalmologist, and myself, Ria Sachdeva. I'm a genetic counselor, also at Shroff Charity Eye Hospital. And we will be the quiz masters. And for timekeeping, we have Nivedita Rathore, who's also a genetic counselor, who's recently joined us at Shroff, and we are happy to have her. And scorekeeper, Miss Ria Pal, who's our department coordinator for both Ocular Genetics Department and Cured Center. And here are our very bright participants. So for the first team, we have our DNA detectives with Dr. Tanmay, who's a pediatric ophthalmologist, and Miss Maitri Jain, who's a genetic counselor in Ahmedabad. So one very interesting thing about our participant teams are we mostly have a mix of a clinician and a genetic counselor. So fits exactly the group very well. The second team is Smart Genes, where we have Dr. Akshay, and he's a consultant ophthalmologist at Shankar Netralaya, and Dr. Srilekha, who's also at Shankar Netralaya and is a consultant. With Molecular Mavericks, we have Dr. Indu Pavni, who's an ophthalmologist at LVP, and Dr. Nilud Parna, who has recently associated with Sri Shankar Deva Netralaya, but is now on her own practice. Then we have the last team, Code Crackers, with Dr. Manju Bhate with LVPI, who's an ophthalmologist, and Dr. Shikrupa, who's a genetic counselor at Shankar Netralaya. And we welcome you all. Thank you for being so enthusiastic to participate. So now we have the quiz rules. We're going to go over them one by one. So for the teams, there is no negative marking throughout the game. Either
It's
player
good.
Yeah. Either player from the team can unmute themselves and speak the answer. Team members can discuss and concur among themselves online itself. Final collective answer to be notified. No mobile phones allowed during the quiz, and each round has specific rules and timings, each of which we'll reiterate right before the round starts. We will not proceed in an ABCD fashion. Teams can get chance randomly. Your team name will be displayed on the top right corner of the screen, and you are to only answer that question, and no answering or prompting each other teams, or from the audiences. We will have to consider that answer void with a 0 mark if that happens. For our audiences and their questions, so audience questions would come in between the rounds, and you are to use the raise hand function in Zoom, and we will keep a lookout on who raises their hand first and give you the chance accordingly. We are going to have 3 rounds in total. The first is the emoji round. In this round, there'll be either diseases, a genetic terminology, a process that you are familiar with in the form of emojis, and you have to guess what the emoji is trying to denote. We will also show you an example in some time of how the round could be. Next is the visual cues round. This is also similar. It will have a collection and constellation of images that will help you understand what suppose the disease is, and there'll be an adjoining 2 part or 1 part question related to the image. And then we have the rapid fire round, in which we're going to ask 10 questions in either multiple choice question format or direct format to each team. So this one is not going to be random. We're going to go one by one through each team with 10 questions, and it will be time bound. So you have to finish answering all the questions in that duration. And the exciting part now, we also have prizes for everybody. So the first prize person gets a sound bar, the second prize gets smartwatch, and the third and fourth prize winners get portable chargers. So all great items, all items that when we saw the list, we wanted as well without participating. So with that, we are ready to start, and I'll stop sharing my screen and hand it over to Dr. Shailja.
Thank you, Ria. So I'm super excited for two things. One, it seems very interesting, all the three rounds and the question amount of learning that will bring, but more so because I'm the luckiest person. I'm the quiz master, not the participant here. So all the best, everyone. I'm sure it'll be fun. Okay. So are we ready? Everybody's ready?
Yes.
Just check your mics. They should work.
Yes. Yes.
Yes. Yeah, we are ready.
Yes, yes.
Yes.
Okay, great.
The timekeeper, I should say, should stay unmuted, because if you suddenly say
Yeah.
10 seconds, then it, yeah.
1 second. Let me just give me a minute. Mm-hmm. Mm-hmm. What is visible, Ria?
It's a black screen right now. Okay, now we can see your presenter view. So I think
Okay.
need to.
Okay, okay. Mm-hmm. I think we'll have to go directly to the slideshow.
Okay.
Just a minute, bear with me, please.
So a correct answer has what, 10 points?
Yes.
Okay.
Can you see now?
Yes.
Just tell me if the presenter view comes or the simple view comes. Presenter view is coming? No?
We
Yeah,
can
now,
see your presentation now.
yeah.
Okay. So you can see the presentation?
Mm-hmm.
Can you see the...
Yes. We can also see your pain, but that's okay. If you can.
Can you see the sample question?
Yeah.
Okay.
Hmm.
But I'm not able to see my presenter view.
Okay.
That's okay. Okay. So round one is the emoji round. This is my favorite round. Here we'll have 4 rounds in the sense that each team will get chance to answer and go through and guess 4 set of emojis, and 1 emoji per team in each round. Each team will be given 40 seconds to discuss and answer the question. They can discuss on the Zoom itself or through the chat box, and there's a 10 point for each correct answer. If you are struggling with the emoji, you can ask for a hint. And if you take the hint, then you just get 5 marks to answer that question correctly. Okay, the questions do not pass to the next team. And we have a sample question. So for example, we have 2 emojis here. Anyone would like to attempt? Or should I give the answer? So this is a pen and entrance. So this is penetrance. Okay, so something like that. Okay, ready to go?
Oh, 1 second. One more thing. The meaning of the words can be in
Yes.
either language, English or Hindi. So
Hindi, correct.
think in both languages. Yeah.
Okay.
Yeah.
Ready to go? So the first question goes to the DNA detectives. Are you ready?
Yes.
Cherry red.
Great, that's correct. Lovely. See, easy, easy. The next one goes for the code crackers. Are you ready?
Yes.
Pen. Pen.
Medal, medal,
Mendelian.
it's some syndrome.
Very good, very good.
Medal and
So remember what Ria said, it could be English also and Hindi also.
Mala.
10 seconds remaining.
Mala.
Mala.
You can ask for a hint.
Time's up.
You can ask me.
Malatia leve. Malatia.
Syndrome.
You can ask for a hint.
Okay.
Von Willebrand.
For a hint.
Yeah.
Von
So,
Willebrand.
no, I think time is up. Nivedita?
Yeah, time's
Yeah.
up.
Yeah, time's up.
Oh, I could have asked for a hint, okay? So I'll
Goldberg
give
syndrome.
just to give an example.
Enadu?
This necklace
Kannadi vandu
is
thednu
actually
pai
har.
kodukku.
It's in Hindi, it's har. So now what do you think?
Golden
Heart.
Correct. Okay.
Golden heart syndrome.
Yes.
Okay.
Okay, so no marks for code crackers for this. Okay, now we move on to molecular mavericks. Remember, you have hint. Don't let go of that. It fetches you 5 marks. Okay, so molecular mavericks, are you ready?
Yes, yes.
So there goes your emoji.
இன்னைக்கு சந்திரன் சேவிச்சா ரொம்ப விசேஷம்.
இருங்க crab. Crabby. Cancer. இது crab.
Maitri has answered.
So only the molecular mavericks have to answer.
வெளியில வரவே இல்லை.
Indo. Crab.
The others, please switch off their
மா
mic.
நான் இதுல இருக்கேன்மா.
10 seconds remaining.
Answer.
So you can take a hint.
Yeah, requesting the audience to please not attempt. The teams will not get marks if the
Crab
answers come from
is-
the audience.
Time's up.
Yeah,
Yeah,
that's
right.
correct. That's correct. Krebs disease, that's correct. That gives 10 marks to molecular mavericks. Good job. Now we move on to smart genes.
Okay.
1 minute. Dr. Pooja Gogri, I am getting your messages. So if you want, I mean, is she participating or?
No.
No.
Yeah, so
Please,
Dr.
audiences,
Pooja,
please do not write the answers in the chat box.
No, Dr. Maitri का मुझे आया. Dr. Pooja का नहीं आना चाहिए. So just inform.
Yeah.
Okay.
We will also request, because
Please don't. Ria, meanwhile, you can even check the chat box, okay? I'm not able to see the participants. My screen is coming. Okay. So now the next question goes to smart genes. Are you ready?
Yes.
And I want the other participants to please mute themselves. So here goes your emojis, and remember about the hint.
Stargardt's disease.
Stargardt's.
That's the easy one, I think. Okay. Again goes to the molecular mavericks. As we said, no particular order, so everybody has to be ready.
okay.
Molecular mavericks, are you ready?
Yes. Dr. Indo. Yeah.
Okay, here goes your clues, your emojis.
Usher syndrome.
Hmm?
Oh, great. See, people are catching up, getting a knack of it.
Yeah, thank you.
Yeah, that's correct. So, Ria, that's 10 points for Molecular Mavericks, okay? Moving on to the next team, DNA detectives again. Are you ready?
Yeah.
So, here are the emojis for you guys.
Cornelia de Lange syndrome.
Mm-hmm.
Tanmay, I'm just guessing out loud.
Quite close. Some of it is correct.
Do you want to ask for a hint?
Corneal dystrophy.
Yeah.
Great, Tanmay, very good.
मैं
DNA
बोले जा रही थी मेरा म्यूट पे था.
Oh,
Oh no.
oh, good, very good. So, full 10
Okay.
points for DNA detectives there. Moving on to smart genes again. Ready, guys?
Yes.
There we go.
Okay, it's and
Boxing glove.
sir, can we ask for clue?
Yeah.
Hint.
Yeah. Hint.
Hint, please. Hint, ma'am.
So, the second emoji is a fan.
Fan. Hands. Fan syndrome. Fan.
Second emoji is a fan, which is
10
easy.
seconds remaining.
It's a syndrome. Okay, it's a
Yes.
fan.
Yes. Syndrome is quite easy. Abans
Man's hand
okay,
syndrome.
and just remember that it could be English
Time's
also,
up.
it could be Hindi also.
I think time's up. Nivedita, you said time's up?
Yeah, time's up.
Okay.
Oh, sorry. Okay, so we move on to the next. The code crackers. Answers to all the emojis we'll discuss after the full round, okay? The code crackers, are you ready?
Yes.
So there you go.
Congenital cataract.
Oh, wow. It's very good. So it's a pediatric or congenital cataract. We'll take both, okay? Okay, so next question again for smart genes.
Okay.
Yes, it's related with eye. Here it's a syndrome and DNA.
This seems
So
to be.
can we go for, is it like Bardet-Biedl syndrome?
No.
So can we ask for a clue, sir?
Yeah.
Yeah.
Okay.
So
Yeah.
the second emoji actually denotes the senses. So sense.
10 seconds remaining.
Okay. So
Second emoji means sense.
since Ashes, no.
Time's up.
Okay, no problem.
Okay.
No problem. We'll catch up. No problem. The next emoji goes to the Molecular Mavericks team. Are you guys ready?
Yeah, ready. Yeah, ready. X-Men. What is it? Cross-linking or something like that?
Can we
Can we
look?
hint? Yeah. Can you have a hint?
So the first emoji means pro. You know, something which is
Proband.
okay. Okay, great. So 5 marks for Molecular Mavericks there. Okay, Ria?
Okay, ma'am.
Now DNA detectives, are you ready?
Yes. Should we ask for a hint?
Yeah, so I'll give you 2. This is a single word. And the third
Okay.
emoji is in Hindi, which means ma.
10 seconds remaining. Time's up.
Okay.
Okay, no problem. Next one comes for the code crackers. You guys ready?
Yes.
There you go.
Hint. Can we have a hint?
Some dystrophy, ma'am. It's some dystrophy.
Yes, yes.
A cone dystrophy.
Yes,
Bone rod
yes. You don't need
dystrophy.
a
Rod
hint.
cone dystrophy.
Very
Yeah.
good, very good. So the hint, actually, I've given a lot of hint here, pointing at the cone here. So it's a rod cone dystrophy. Great. Next one goes for the DNA detectors. You guys ready? Everybody's
Yes.
doing so great. When I got this list, I got hardly 4 or 5 correct. Now, what is this?
Translation.
Wonderful. Next one is for the code crackers. Are you ready?
Yes.
Part of
Hint.
it is already. Pardon?
Hint.
Are you wanting the hint?
Yeah.
So the second emoji is actually a face of a man. So the emoji means man.
Angelman syndrome.
Very good. So there goes 5 points for code crackers. Next one goes for the molecular mavericks.
Yeah. Okay.
Ready again?
Yeah.
Yes. So
Key rat us.
You're close.
Key mouse.
You were better off before.
Key rat. Something.
Hira. We can get a hint actually.
Yeah.
Hint.
If I give you the hint, you'll catch it anyways.
10 seconds
So this,
remaining.
okay, so the third one, you concentrate on the shape.
Keratoconus.
Correct.
Yeah.
So 5 marks for molecular mavericks. Smart genes again.
Okay.
Ready?
Yeah.
It's easy.
Turner syndrome. Turner's.
So it is. I just this will not be counted as a hint. I think this just depicts does not depict a disease. I mean, disease depicts a disease, but a collection of disease. It's like
Karyotype.
yeah, but
So can we get a hint?
10 seconds remaining.
okay. So this is a type of that
Defect. What the
defect.
example that you
Defect.
gave?
It is an numerical abnormality.
Yes, yes, yes. In the chromosome.
Chromosome numerical
Time's
abnormality.
up.
What is this abnormality called?
Turner syndrome.
No, Turner's is syndrome, but
Okay.
what happens in that? What is the abnormality in the chromosome which is pardon?
Said
Time up.
Okay, time up. Okay, no problem. So that brings us to the end of round 1. And everybody was excellent.
yeah.
So meanwhile, while our scorekeeper adds on the marks and let us know who's where on the leaderboard, we can go ahead with 2 audience questions. And if time permits, we'll go with the answers for all the rest of the emojis. So is audience ready?
You are not in screen share mode. I mean your
Yes.
presentation is not exited.
Okay, audience is ready. And the audience have to raise their hands. Ria, you'll have to see the
Yeah. It's
raise the hands, and whoever raises first, then that person can unmute and speak the answer. I'm moving to slideshow. And this is the audience question number 1. And your time starts now.
Ruhi, you can unmute yourself. Ruhi M.
Niemann syndrome.
Yes,
Uh,
Niemann and what? Niemann what?
Syndrome.
Niemann's pick.
Yeah.
Pick syndrome.
Man's
Yeah.
picks.
Yeah,
Yeah.
Niemann. Oh, that's great.
That,
Lovely.
that was fast.
Yes, pretty fast. So next time we'll call Rui for the participating.
Yes.
Okay, so the next audience question. Let's see who raises the hand first.
Arshi Nazir has raised.
Yeah, but I think वो पहले से. But if you want to take a go, please do.
No, that was for the last one.
Acha.
But
Try.
try.
Again.
There's Ruhi again.
Okay, Rui, go ahead.
Is it Trousseau syndrome? No.
Which syndrome?
Trousseau syndrome, no?
Mm,
I mean,
you're
it's very close.
I'll answer.
No.
Yeah.
Croissant.
And
Croissant
No, the
syndrome.
the emoji is croissant.
Croissant.
The actually
Yes,
syndrome is a croissant syndrome.
Yeah, croissant.
Adeline
Croissant.
Lasrado has written the same answer in the chat box.
Oh, great, great. So maybe if we have time and she's totaling, we can go through the rest of the emojis and go through the correct answer. Okay, so
This we got right.
this was answered correct. Cherry red spot. This was golden Haar syndrome. This is Crab's disease. Anybody wants to actually, now everybody can actually unmute and say, maybe I'll not say. This was answered correct. This was answered correct. Anybody wants to attempt this?
Marfan syndrome. Marfan syndrome.
So that's like a mukka. It's Mar, okay? Marfan syndrome. This was answered correctly.
Is it nonsense mutation?
Nonsense mutation.
Nonsense mutation. This was answered correctly. What is this?
This is achromatopsia.
Yeah.
Correct. This was answered correctly. This was answered correctly. This is also correctly. This is keratoconus. This was
Aneuploidy.
Monosomy.
Aneuploidy.
Monosomy?
Monosomal aneuploidy also, right?
Yeah.
Deletion.
Aneuploidy.
Yeah.
That's it. See, not that difficult. So do we have the answers, bacha?
Okay, 1 minute. Again, some Adeline Lasrado का message आ रहा है chat पे
हाँ
मुझे.
जी.
So, I mean, ये
Audience round के लिए हाँ.
no, वो मारफान का. Anyway, I mean,
Yeah.
maybe she. I don't want to have the disadvantage of being disqualified.
रिया स्कोरिंग हो गया बच्चा.
ये वो हमारा क्रो जैसा नहीं दिख रहा था. By the way.
So black bird, what else? It is crow.
Crow, achromatopsia, no?
It is
Crow.
crow only. Has Riya disconnected?
No, she's here. Riya Pal, Riya.
Then, okay, Riya, maybe you move on to the next. I will try to connect the. We'll reveal the score after the second round, okay?
Can you see my screen? Is my screen visible?
Yeah,
Yes,
yes.
it's visible.
Okay, so on to the next round, the visual cues round. Yes, so the rules, this round, we'll have 2 rounds for each team, again randomly. Each question carries 10 points. And in 2-part questions, there'll be 5 marks for each part. And you will get 30 seconds to answer each question. It'll be similar. The name of the team will flash and then that team takes a go at it. So everyone's ready?
Yeah.
And requesting the audiences again, now you are not to attempt these questions, only the participating teams.
Riya? I'm not able to connect to Ria. So what I'll do is I'll keep score for this.
Okay.
Okay, and then we get back to her for the previous round. Otherwise, we remember and we can mark again. Okay.
Yes. Yes.
Yeah. Okay. Just give me a second. I'll get a pen and paper. Give me a second.
Okay. Okay, Ria has sent the score. Right. So, should I just speak it out? So DNA detectives are at 30 points out of 40. Smart genes are at 10. Molecular mavericks are at 30. And code crackers are at 25. So congratulations, everybody who's leading, and everybody else needs to really get it together in this round to compete.
Yay! So we have molecular mavericks and DNA detectives tying up after the first round. But there's a lot of scope to catch up. So rest of the two teams buck up.
Okay.
Should we start with the second round? Everybody's ready?
Yes.
So this question is for the molecular mavericks.
Okay.
So I'll now display the question. Identify the disorder and name the two systemic features that are shown here.
Is it Will Marcheson?
Yes, go ahead. Doesn't
10 seconds remaining.
can like 10 seconds for the first question?
Yeah.
So
For the entire
we'll
answer.
go ahead with Will.
For the entire.
So we'll go with
Time's up.
We'll go with Will Marcheson. It's like stubby fingers and short stature.
Okay. Okay. So for now, we'll move on.
Then you can say if it's not the correct answer.
Okay.
But we'll not disclose the right answer right now.
Whether it's correct or right, just let us.
It's not correct. Yeah.
Okay.
So next question is for DNA detectives. Ready?
Yes.
Yeah. So this is the image. And this is your question.
Name the so
Name
it
the
is
transcription.
splicing.
Mm-hmm.
And then at what stage of central dogma? So transcription.
Mm-hmm. Do you want to
Yeah.
add to it?
You have to be confident and say yes, this is the answer. Okay. If you
This is
answer with a question mark, then we can't take it.
So the process is called splicing.
Mm-hmm.
And it occurs during transcription process when DNA is converted into RNA.
That's correct. That's correct.
You're totally correct. Just say, yeah, this is the answer.
Yeah. Okay. So next is for smart genes. Ready?
Yeah.
So can we answer this?
Yeah, yeah.
So it is a process of translation where the polypeptide chain is formed.
Yes, Ria, please share the questions also. If you click once more, the questions will come.
Okay.
The process is translation where the polypeptide chain is formed in the cytoplasm, where the tRNA collects the respective amino acids and the polypeptide chains are being added.
Yes, that's correct.
Perfect.
Perfect. Code crackers, are you ready?
Yes.
The association would be like a charge syndrome.
That's right.
Name two
10
other
seconds
missing.
remaining.
Sorry?
10 seconds remaining.
Yeah, two missing features not shown. So see. So mental retardation is not there, and
Thumbs
here
up.
is choanal atresia.
I think we have to give them that they were in the middle of
Yeah.
a
Yeah,
sentence.
yeah.
Yeah?
Yeah.
Yeah.
Correct, correct.
Hmm. Okay, smart genes. These are your images. This is your question.
The inheritance pattern of this disease is autosomal dominant, and the disease is multiple syndromic features actually.
10 seconds remaining.
Sir, Akshay sir, can you able to
Um,
identify the disease?
I mean, I can see a plaque on the skin, some hair loss,
Time's up.
ataxia telangiectasia. No.
So time's up. That's not right, but we'll come back to the answers.
So one part of the answer I answered.
No, no. No. Inheritance pattern also. You said autosomal dominant, right?
Yes, ma'am.
No, it's not correct. We'll come back to the pedigree again.
Molecular mavericks.
Dr. Indu?
Yes, we are.
From male to female, male. So all the generations are affected. So there is no male. So it is an autosomal.
Autosomal dominant.
Mm-hmm.
Okay, and autosomal dominant. Any disease we can name, right?
Mm-hmm. Yes, any.
Say
Sorry, 10 seconds remaining.
say any disease.
Any
Say that is autosomal dominant.
Disease autosomal dominant.
It's like
That is
Marfan syndrome.
Time's
Marfan
up.
or anything. Yeah.
Okay.
Okay,
Yeah,
okay. You got it.
Okay.
Okay, code crackers. It's you now. So, what is the genetic phenomenon depicted in this test? And name an eye condition that may harbor this type of genetic defect.
It's a translocation,
Mm-hmm.
and translocation can happen in retinoblastoma.
That's right. That's right.
Wonderful.
Okay, DNA detectives, on to you.
Neurofibromatosis,
Mm-hmm.
name Lish nodules,
Mm-hmm.
which class of disease with neurocutaneous disorders.
Perfect. Perfect answer. Yes.
So DNA detectors. Great.
That's it. We are at the end of the round.
Well done. I think everybody should clap for each one of them.
Nice. So do we do audience questions first or should
Yes,
we?
yes.
Yeah, all right.
So again, audiences, be ready.
So
your
my
questions?
screen is full screen. Is someone else having a look at?
Yeah, I'm having a look and
Yeah.
I can see it.
Okay.
Anybody from the audience?
Barrett-Biedl syndrome.
Okay, you have to but raise your hand first. But okay, fine, go ahead.
I'm so sorry. I'm so sorry.
No, Tasneem, yeah, go ahead.
One additional feature.
One additional feature.
One additional feature. Obesity.
Yeah.
Yay, very good.
Okay, next one now.
Ready?
Oh. So guess the movie.
I would have told it's not a disease, it's not a syndrome. It's nothing.
Yes,
related to.
we're switching off for just
That's
1 minute. Guess the movie.
It depicts a movie. Even the participants can attempt. I think audience, nobody is.
Hindi or English movie? Sorry?
Hindi movie, English words.
Yeah.
Hindi movie.
Tokyo, New York, something like that. or what?
London, Paris, New York.
London,
Yeah.
Paris, New York, correct.
There's a movie like that.
Tokyo ka isme Lutfana.
Exactly. Akshay, I was just going to ask that question.
London, Paris, New York. The first time I'm hearing of it.
Even I heard it first time.
Hydri and Aliza.
Oh my God.
Ali someone.
Yeah.
That Pakistani actor, yeah.
Yeah.
Oh, great.
Yes. Ria, do we have the scores for this round?
Do we get points for this movie?
No.
Please. Can we have the answer for that one we missed?
Yeah. Let's go back to the slides. You want me to? Because next I have to share.
Yeah. Okay.
Okay.
We missed on that.
Does
Can you see my
anyone
slide?
from the audience, no, from the other participants want to take a guess at that one, the one we missed?
Can you see the slide?
Yes.
Could it have Wolf Storm or something like that? Did we miss?
This one.
Yeah.
Yes.
Yes.
Down. Yeah, this is MPS.
MPS, okay.
Camptodactyly of the finger.
Pose face, facial features gives the hint,
Yeah.
Gives you the clue. So one of the systemic features, coarse facial, and these are?
The protrusion.
Camptodactyly.
Enlarged tongue, yeah.
Yeah. Claw hands, yeah.
Claw hands.
Yeah.
What's in the eye?
This is
Corneal clouding
Hunter
is not
syndrome, where the eye cornea is actually clear.
Yeah.
If it would have given cloudy cornea, it would have become quite easy then.
Yeah, X-linked.
Yeah.
Yes, okay. Thank you.
Okay. So this was done, answer was given perfectly. This was also, I think the video was also correct, translation. Oh, sorry. Yeah. Then this was Chart syndrome, again answered correctly. This was, anybody wants to attempt?
Incontinentia pigment.
Correct.
X-linked.
X-linked dominant, yeah. So because of no skip generation, dominant comes, but then if you, males are always giving it to females and females are giving equally to both males and, yeah. This was also answered correctly. It's a balanced translocation, but that's again correct. And this was also correct. Okay, so do we have the score? Okay, so I think, okay. So I have the scores. So we have the DNA detectives leading at 50 points. Then the code crackers at 45 points. Third is the molecular mavericks at 40 points. And smart genes is at 15 points. Okay, so the rapid fire, the next round is actually having 10 questions, 10 marks each. So it's a very big opportunity for everyone to score. We have around 2.5 minutes for each team to answer the questions. There is 10 points for each correct answer. No negative marking, no half points of 5 points here. If the time is remaining, you can go back to the unanswered questions. That means the questions that you have passed. The questions that you have wrongly answered, you cannot reattempt them. Okay, are the rules clear?
Yes.
Okay. One second. I'll just... One second. My slide went off. Yeah. Okay. So the first team to attempt the rapid fire would be the code crackers. Are you ready, guys?
Yes.
Ready, set, go. What does compound heterozygous mean? And your options are there.
Two different mutations in different allele in the same gene.
So the answer is A, B, or C?
A.
Okay. That's right. The GUCY2D gene is involved in which of the following?
Congenital process A.
A, correct. What is the most common direction of ectopia lentis in Marfan syndrome?
No options.
Most common, no options. Some of them are direct questions, some of them have options.
That's right.
Superotemporal.
Correct. Which genetic test is most appropriate for detecting large deletions and duplications in ocular genetic disorders? Those are your options.
Fish.
That's correct. White forelock plus hearing loss plus heterochromia iridum. Who am I?
1 minute is gone.
1 millibrand. I'm just not getting that word just now.
Can we go for the next question?
Yes.
Yeah.
Which one of these is an example of epigenetics?
DNA methylation C.
Correct. Which one of the following diseases is characterized by night blindness and progressive peripheral field loss, peripheral vision loss?
RP.
Retinitis pigmentosa.
Correct. Schneider's corneal dystrophy is a genetic disorder causing dash in the cornea. Which types of deposits?
Crystalline.
Perfect. I am a mitochondrial disorder causing central centrocecal vision loss, cardiac conduction defects. Who am I?
CPEO.
That's wrong.
No, 1 minute.
What type of inheritance is seen in RPGR mutation?
Extinct recessive.
Perfect. So you got 8 out of 10. That's
Can we go back to the unanswered?
Both of them were answered wrong, so you can't go back. You could have passed.
Okay.
Okay. So if you could have said just pass, then we could have gone back. 8 out of 10.
That's
for the code crackers. That's lovely. A very nice rapid fire round. So now we move on to the DNA detectors. Are you guys ready to go?
Yes.
Okay, rest others, please mute your mics. No prompting. Your time starts. Now, Nivedita, are you ready?
Yes.
Yeah, okay, fine. Which ocular genetic conditions is not linked to mutations in PAX6 gene?
Albinism.
Perfect. Name two non-ocular features seen in Axenfeld-Rieger syndrome.
Teeth, dental anomalies.
Dental hypoplasia and umbilical anomalies.
You have to name the exact anomaly.
Umbilical hernia.
Perfect. What is pleiotropy? And your answers question. Your options are there.
Maitri, go for this.
Not a genetic change in a single gene causes symptoms. B.
Are you saying B?
B, yeah.
B, that's correct. What gene is commonly mutated in primary congenital glaucoma?
CYP1B1.
Correct.
Perfect. Retinal degeneration plus neurodegenerative disorder plus regression of milestone after 2 years of age. Who am I?
Neuro CL
Rett syndrome, do you think?
You both have to concur and give the answer.
I'll tell this. Neuroidal, ceroid, neural lipo. What is that?
Okay, we'll go to the next one.
CLN gene.
Is that your final answer?
Yes.
Tanmay? Okay, correct, Tanmay.
Correct.
Which gene mutation is common in autosomal dominant optic atrophy?
OPA1.
Perfect. What does CRISPR stand for in genetics? And these are your options.
The first one, clustered. No, sorry, cluster. The D. Last one.
So donkey?
Yeah, the last option.
Yeah, that's correct. Which ocular disorder is associated with Alagille syndrome?
Posterior embryotoxin.
2 minutes gone.
She said C.
I said C.
Posterior embryotoxin. Yeah, I'm also forgetting the answer.
Come back.
Okay, go to the next one.
Okay. This retinal degeneration is characterized by splitting of the superficial rays of the retina.
Like juvenile retinosis.
Perfect. Last question. The differences between whole exome sequencing and whole genome sequencing are all except.
Machine used.
Perfect. So I think I'm 9 correct, but I need to confirm.
That's right. Posterior embryotoxin is right.
Correct. So all 10 correct. Oh my God. Oh my God. Oh my God. So this was molecular mavericks, right? No, DNA detectives. I'm forgetting.
Yeah, DNA detectives.
DNA detectives, right. 10 out of 10. Lovely. Smart Genes, are you ready to go?
Yeah.
Everybody else, mute your mics. Only team Smart Genes. Which of the following disorders does not cause bull's eye maculopathy? Does not cause bull's eye maculopathy.
Gyrate atrophy.
Perfect. What does a Revel score measure in genetics?
Srilekha?
Rebel score. No, it is. We'll go
Okay,
for it.
pass.
Okay. What is the FDA approved gene therapy for LCA caused
Luxturna.
Perfect. Which famous historical figure is suspected to have had retinitis pigmentosa based on documented vision loss?
Helen Keller.
That's incorrect. What is the likelihood of a child inheriting a mitochondrial disorder if the mother is affected?
Close to 100%.
Close to 100%. Perfect. Name any two syndromes related with congenital cataracts.
Congenital rubella syndrome.
That's okay, but that's not a genetic syndrome. We're looking for genetic syndromes.
Okay, pass.
Okay. What does endogamy mean?
Srilekha?
Marriage between the individuals of the same family. B.
Did you say B for ball or D for donkey?
B for ball.
Oh, that's wrong. Craniosynostosis plus corneal opacity plus short stature. Who am I?
Pass.
Next one.
What are the causes of leukocoria in children except?
Brushfield
What are the
spots.
causes? Yeah.
Brushfield spots.
Brushfield spot. What condition is associated with the CHM gene mutation?
Choriodermia.
Okay. So that is 5 out
Can
of
we go
10.
back to the answers? Yeah.
Yeah, you can.
Questions.
Okay,
Yeah.
fine. I think Revel score was the
We'll
first one.
Yeah. So, okay. Next one. I just don't have Rebel score. I don't have the idea. Next one. This we told.
This one was
This
answered
the
wrong.
answer. Yeah. This.
Two syndromes, just
Name two
attempt.
syndromes
Lot of
related
time.
with
Two genetic
congenital
syndromes. Congenital cataract. Congenital or maybe near congenital, you can take infantile cataracts also. Infantile cataracts.
Down syndrome.
Okay, fine, no problem.
10 seconds remaining.
Down syndrome and?
The one with hypotony. Come on, I just can't get names today.
Time's up.
Syndromes. No.
Time is
Okay.
Okay.
Okay. No problem.
You've come on the question. You need to go back.
Oh, sorry. So finally, to the last team, Molecular Mavericks. Are you ready, guys?
Yes.
Nivedita, ready?
Yes.
So there you go. Which nutritional supplement is contraindicated in ABCA4 related retinopathies?
You want to try?
No, we'll pass.
Pass.
Mutation in FOXY1 are associated with eye disorder.
Or battle hemangioma.
No. It's
Okay.
Alexander syndrome.
Okay, take it. Then we'll go ahead.
Is your final answer, both of you?
Sure? I don't know. I think it is orbital hemangioma.
Final answer?
Final answer, both of you?
Okay, let's go ahead with A. Okay.
Sure?
Okay.
Yeah, sure.
Okay, that's correct. Corneal opacities plus antirelenticonus plus cataract plus deafness plus glomerulonopathy. What's
Alport syndrome. Alport.
Alport syndrome. Very good. Name two genetic conditions having ocular manifestations that occur due to inborn error of metabolism.
Mucopolysaccharidosis and
Homocystinuria.
homocystinuria, yeah.
That's right.
One
Okay.
minute gone.
1 minute gone. Okay. What is a proto-oncogene? And these are your answers. These are options, I should have said. Yes.
I think we'll go with B.
D, yeah.
That's wrong.
Hi. Okay. Next question.
Name two techniques to study chromosomes.
Can you, Doctor,
To study chromosomes as in testing or?
Testing. Yeah.
So we can go with karyotyping and chromosome microarray.
Yeah, that's fine.
Okay. So macular dystrophy in Best disease is typically diagnosed using which test?
2 minutes gone.
Macular dystrophy.
Electroocular. A.
Electrooculogram. Correct. Who discovered the 2-it hypothesis linked to retinoblastoma?
Knudsen.
Yes. Okay. Full name? Otherwise, we'll move. Okay. Which non-mammalian species has been used in ocular genetic research due to its ability to regenerate retinal cells?
Zebrafish.
Zebrafish.
Okay. Correct. What is the common non-ocular manifestation of Norris disease?
Non-ocular. Norris is.
We'll go with the
Time's up.
deafness.
Deafness, yeah.
You sure? Final answer?
Okay, deafness.
Correct. That's correct. So that brings us to the end of the quiz for the participants. And Molecular Mavericks answered 9 out of the 10 questions. So while we are finally totaling the results and coming to our winners, there are some more audience questions. Is the audience ready?
Audiences?
Ria, are you seeing the audience?
Yeah.
Yes. So identify the syndrome. Sorry. Identify the syndrome.
I think participants can also have a go then. Nobody's from the audience.
Epidermolysis bullosa or something related to that.
Epidermolysis bullosa is right.
Okay.
Okay, Dr. Shelja, next slide.
I know this one.
I think nobody's from the audiences. Oh wait.
Mild scan and autism.
And the movie.
Autism. My name is Khan.
Yeah.
And which condition?
Asperger's.
Asperger's. Yeah, Asperger's. Autism. Yay. That was quite interesting. Do you want to go to the answers of the rapid fire which were missed? I think most were given correctly.
Yeah.
We can
So
go
the
to
syndrome with like congenital cataract, we can include Nance Orange syndrome. Will that come under it?
And also galactosemia, I think. That
Galactose.
Yeah, galactosemia, lowest syndrome, I think.
Yeah, I was trying
What
to.
you wanted to. I know, I can totally relate with it. Naam nahi pata, nahi aa raha, nahi aa raha.
Nance-Horan syndrome can be included in
Yes, it can be, but congenital, रहता है,
Yeah.
9 or they can have
Yeah.
congenital opacities which increase with time. So,
Yeah.
so I think code crackers got 8 correct. Compound heterozygous was correct. This was correct.
This is fine.
This is also correct. This was
Wardenburg.
Wardenburg, not von Willebrand. I think we tongue twister there. This is
That word just doesn't come at the right time, and
Yeah, I
you just
know.
put WW somewhere.
Yeah, this is correct. This was actually LHON plus.
Members, yeah.
LHON with cardiac conduction. Even LHON बोला होता तो चल जाता. This was correctly answered. DNA detectives got all correct, but if everybody wants to go through them again, so this was albinism. This was 2 features, yes, non-ocular they've mentioned. Hutchison's teeth and umbilical hernia. Pleiotropy was when genetic change in a single gene causes symptoms in different organs of the body. That is pleiotropy. Gene commonly mutated CYP1B1. This was neuronal ceruloid lipofuscinosis. OPA1. CRISPR is clustered regularly interspaced short palindromic repeats. This is posterior ambrotoxin. This was juvenile retinoschisis, and this was machine use. So same machine is used for exome and genome. But the coverage of introns, depth of coverage, and data volume is different. Coming to smart genes, bullseye not causing is gyrate, correct. Revel score is, I think, the pathogenicity.
Yeah.
Level of pathogenicity. Yeah. Even I came to know through this quiz. And Luxturna is correct. This is Charles Darwin.
Oh, okay.
This was correct. 2 syndromes we just discussed. Endogamy is marriage between individuals of close geographic.
First term.
Same family's consanguinity. This was mucopolysaccharidosis, rhinosynostosis, corneal opacity, and short stature.
Oh.
This we got correct. Yes, this we got correct. For molecular mavericks, I think all were correct. Nutrition supplement contraindicated is actually vitamin A.
Vitamin.
Right now, I got it. Vitamin A.
Yeah.
I
So,
didn't see.
Foxy one is correct. Axenfield rigor. This was Alport. This you also got right. Protooncogenes was so proto-oncogene, and the other one is tumor suppressor gene.
Okay. So I think we got it wrong here.
Oncogene is gain of function. Tumor suppressor is loss of function. So this was a little tricky one.
Yeah.
So I think molecular mavericks then got 8 correct, right?
We didn't get
We
correct.
didn't
This one and that
got it
one
wrong.
both, yeah. Then 2 techniques to study chromosome was correct. This was EOG. This is Alfred Knudsen. And this is zebrafish, correct. Deafness is correct. Thank you, everyone. So we are having the final results. Any guesses?
Detectives, DNA detectives.
Yes, you're right. So first prize is DNA detectives. Yay! Yay!
Thank you.
150 points.
Congratulations.
150 points. And the second and third actually very close. The second is, any guesses? So it's very close between Molecular Mavericks and Code Crackers. With Code Crackers, 125 points. And Molecular Mavericks, 120 points.
Ish.
So we have second as Code Crackers.
Congratulations.
And Molecular Mavericks have 120 at 3rd position. And Smart Genes at 65 at 4th position. So wonderful. I think it was real fun.
Yeah, thank
Anything
you.
you guys want to say as participants?
Yes, absolutely. It was fun, and hats off to you both for this so much effort.
Yeah, seriously.
Really well conducted and
A
well
lot of
thought out.
effort in putting it together. Thank you.
Yeah, so the whole team, I think Nivedita is a new genetic counselor. She has also prepared a lot of questions. And Ria has also, both the Rias, we have two Rias. Ria is a lucky name for us. So
Duplication.
both of them have taken
Correct.
lots of effort to.
Margins get additional point for this witty answer.
Who? What did Akshay say?
I said duplication.
Duplication bola uske.
Oh, right. So yeah, that was really very, we all enjoyed actually making the questions.
Yeah.
And, when you make questions also you learn. Otherwise, I would have never known what these things are, especially of the basic genetics. And even if you read, you forget. So it's, I think, a very fun way of learning. Maybe we'll have, repeating it in the OGIG. We'll want to.
Biannual we can do.
Pardon?
Biannual.
Yes, biannual or maybe even annual would be good.
Yeah.
Very good. I think it wasn't that difficult, right?
It wasn't that difficult, but I would like to say one compliment to Dr. Tanmay. She was, from the beginning, she was on rapid fire. We were like,
Tanmay, acha, who actually prepared for it?
See, I read the Will's thing. I went through it.
Oh,
So
great. So that's,
Dr. Tanmay, she told me
paid
to
off.
go through the Will's eye manual. So even today, last 2 hours, I was just brushing
Oh
through
my
that book.
God.
It's
So
really concise and
was that on the group also
accurate.
that I'm
no,
getting?
I from Dr. Indu. Thank you so much. The wills, but didn't have that much of time. But it is really helpful. It is really helpful that I could understand.
Everybody was, superb, I mean, मुझसे तो नहीं होता इतना सब. Especially the emojis, guessing it was very, very quick. All of you got it, many of them right.
Yeah.
So some actually emoji round, 3 teams have got nearly all 4 correct. Either partly or this. So wonderful. So with that, we'll come to the end. And thank you, lovely audience, for participation. I was actually not expecting so many people. I thought we'll just have fun with the participants who would come for a quiz. Probably people. But
What
thank
about
you
our
so much.
prizes? Prize courier करो.
प्राइस कुरियर ही होगा. प्राइस कुरियर होगा.
आप
Okay.
एड्रेस सब लोग भेज दो अपने
So the
एड्रेस भेज
team one, the first prize winners will get a, what was it? It was yeah, it's a Bluetooth speaker, and then somebody has the second prize is a smartwatch.
I wanted a smartwatch. We should have come
I'm
second.
getting a smartwatch. Yes.
स्मार्टवॉच सी देखो, हम लोग गरीब लोग हैं, बहुत पैसा नहीं है इतना, आपके यूज के लायक नहीं. You can gift it or give it to kids. I तो
Apple Watch नहीं चलेगा.
कह सकते. You can give that real smartwatch. So it is, yes, not bad, but a smartwatch. And the third and fourth prize is a wireless charger. Okay, so you will get it probably within a week.
Can we also get a
And,
wireless charger? I
do
think
send
it's
your
very useful.
addresses. Do send us your
Maybe we
address.
should have come second or third.
Who? Oh, you want a
Wireless
wireless charger?
is something. Yeah.
Wireless charger is very useful. Very
So we
useful.
get
Yeah.
the wireless charger or only the charger? Is the phone compatible with the charger?
वो आदू आ गया.
आदू आ गया इधर. इधर करो, हाय बोलो सब. बोला आपने. So, thank you everyone for joining.
Thank you.
Thank you all the
Thank you so much.
participants. Thank you all the.
Congratulations and thank you so
Thank
much. Yeah, both of Daria. Thank you. Good night.
Bye. Good night.
Good night.
Oh, just wait. We'll have a group picture.
I did it. I took it in
You
the
did it? Everybody was there?
Mm-hmm.
Nobody's missing?
No,
Maitri.
Maitri
She
left,
locked
I
out.
think.
She left?
But I have it from the beginning when everyone,
Great.
before
Anyways, we got it
participants.
also. So we'll have it. Okay.